Hi, I'm Mayor Jim Darling. This is Meeting with the Mayor. And today we have Cris Rivera, who's the CEO of Regional Hospital here in McAllen. Cris, welcome.
Thank you. Thank you, Mayor. Thank you for having me.
And you know, we're right in the middle of COVID-19 virus, and so we're going to talk a little about that, but let people know we have our masks today.
We do.
But we're practicing social distancing, and so that's what people should do. It's about 6 feet, and it's what they say is the safe distance.
That's correct.
Now, you know, things have been opening up. In fact, the governor just released phase 3 of the plan, pretty well opening up restaurants and bars and all that to, I think, 50% and then 75% capacity. So it's important that we understand that the virus is still there, even though it appears that we're almost back to normal, I would guess.
Yes, sir, that's absolutely right. And even though we all like to socialize, in this situation with COVID-19, we must safeguard ourselves, wearing our mask, keeping a 6-foot distance, enjoying our lives, absolutely, but we must be safe, protect ourselves, and protect others.
Now, one of the things they always say in the paper when they give the numbers, they always say at the end, most people just have symptoms, mild symptoms, or even no symptoms. If you don't have any symptoms, I guess it doesn't really make a difference, except you can give it to somebody else. But there is a good majority, not a majority, a good deal of people that actually get very, very sick and unfortunately pass away from this, and that's the most vulnerable. Can you explain how that works?
Right, and it's unfortunate, but there are populations that are most vulnerable, and those are the elderly. But with COVID-19, it does not discriminate against age. Unfortunately, we are already experiencing some pediatric or population, or our children that have COVID-19. We also have the teenage population, we have the middle-aged population, and of course the elderly. So we must continue to be careful and protect each other.
And these are people that have been hospitalized, all age ranges have been hospitalized with it and or worse.
That's correct. Here in the Rio Grande Valley, and unfortunately across the nation, and also across the globe.
So as you go out into the public or work, whatever, social distancing is always important, and wear a mask, and that's not only protecting you, but it's respect for other people.
That's correct. There's a few other recommendations that I would like to make is the fact that we also need to wash our hands. Hand hygiene is extremely important, and not touching our face because most of this COVID disease does unfortunately enter through our nose, mouth, eyes, and so we've got to be careful with that.
Especially on your hands if you have somebody at home that's in a vulnerable position because of age or illness or whatever. I always carry it in the car, and I always wash my hands before I go into the house, and make sure you do that. Even though you say, well, why, you're going to have contact with them, you're carrying it on your hands. You may not have it, but you can carry it on your hands. So.
And I don't want anyone to be fearful. I want everyone to be cautious and to be careful and make sure that they are taking our advice in protecting themselves and protecting others.
Now, people can be too careful, I understand, by not seeking medical advice when they actually need it that has nothing to do with the virus.
That's correct. And so I do recommend that if you do need medical attention, do not hesitate to access medical attention. And at Rio Grande Regional Hospital, it is one of the safest environments that we have for various reasons. One, we do make sure that everyone is wearing a mask. We provide the appropriate protective supplies that our staff needs. All visitors, our patients, we do have a very safe environment.
You know, a hospital has a safe environment all the time.
That's
correct. Because it's the nature of a hospital. So even in these times, they've even gone to extra precautions for people.
That's correct. So we at Rio Grande Regional Hospital have, and you're absolutely right, Mayor, we have always provided a safe environment. We provide safe care, but now with COVID-19, we've taken additional steps to do that. And some of the steps that we've taken is to make sure that upon entry, we do provide sanitizing supplies so that everyone can sanitize their hands. We provide the masks. We provide an appropriate entryway stay for all of our visitors, and we provide extra care, safe care for our patients.
So now, if somebody has a COVID symptoms, are they triaged before they come into the facility so that they then can be automatically isolated?
Absolutely correct. If they do have symptoms, and then of course we're going to test for COVID, we do have a special infectious diseases unit that we admit those patients to so that they can be protected in one area, not only a protection for the COVID patient, but also protection for all other patients that are in our facility.
Now, some people want to be admitted if they just have normal symptoms, it's COVID, but they don't know it's normal symptoms. If they go to a hospital, will they automatically be admitted, or does it have to be at a certain level of seriousness?
Our medical staff is, of course, very well informed and knowledgeable of all types of diseases, and they are paying extra attention related to COVID. So they will triage the patient, they will assess the condition, form a diagnosis, and then the appropriate care will be provided to the patient.
I notice in the statistics, the vast majority of people that get COVID, they get sick, but they don't get hospitalization.
A lot of patients do not need hospitalization. They can recover at home, which is ideal. But if they do need hospitalization, we are a safe environment to be able to provide that.
You know, I was thinking when you said safe environment, it's always been the practice and actually requirement every time a nurse or a doctor or anybody touches a patient or comes in contact with a patient, they wash their hands every time.
Absolutely.
So hospital workers are used to washing their hands, literally 10, 20, dozen times a day, every day. So that's second nature to hospital people.
Absolutely. Every time one of our employees is and clinical providers are going to enter a patient's room, they are to wash their hands, and then as they exit, they do the same thing.
So people, by avoiding going to the hospital or even the doctor's office for ailments, they said people with strokes aren't going to the hospital. If they feel heart, chest pains, they're not going to the doctor. That's really putting them at greater risk than the virus, for instance.
Exactly. And that's why I want to be very clear that Rio Grande Regional Hospital is a very safe environment, and our population should not delay in seeking appropriate care. Delaying will make things worse, unfortunately, and so therefore it is important that everyone does seek care when they're not feeling well.
Right. So if you're going out any place, you should feel safe going to the hospital.
Absolutely.
And if you're staying at home, you don't want to be have complications increase and then really get sicker than you need to be without going to the hospital first.
Exactly. And if anyone needs any other information or has other additional questions, I invite everyone to call me directly. I have received a lot of phone calls to be able to have these type of questions answered, and so I'm always available, so I'll be glad to help. Well,
I've been out a little bit, and I think you have too, and I've seen less people wearing masks. Keep wearing the mask. It reminds you not to touch your face, for instance. And then social distancing, I've seen some pictures on social media where people are not kind of ignoring that too. But they need to realize it's still out there. We still have it. It's something that we need to pay attention to and protect ourselves against. It just makes common sense. But I think people have been cooped up, and common sense doesn't always prevail.
Well, we always like to socialize, but let's be safe and socialize safely and appropriately, and access care when it is needed. We do provide a safe environment.
Yes, and we see some of the statistics coming forward. Somebody has it, and they've given it to a whole group, for instance. So you don't want to give it the virus to your best friends or family members, for sure, and so that's part of being smart.
That's right, absolutely.
Well, Cris, thank you very much, and we appreciate you, and you're a hardworking person, I know, and the CEO of a large hospital, and you're a Valley native.
Yes, absolutely. I love the Rio Grande Valley, and I'm here to serve, and all of our staff and medical staff, our physicians, our nurses, all of our technicians are here to serve this community that we love so much.
Well, I think you're an inspiration and example for all young people. If you work hard, study hard, and get a good education, you could be a success.
Well, thank you very much. And it's the support that we all receive from everyone like yourself, Mayor, that does help us be able to give back to our community.
Thank you.
Thank you.
Well, thank you for joining us, and be careful out there.